Hello, everyone. It's Thursday, May the 14th. I keep telling you, and I've told this a long time ago, but every day that goes by, we get closer and closer to a drug that will stop this situation and maybe send our lives back to complete normalcy. But we still got a ways to go. And I caution you over and over and over on the fact that as good as our numbers look, I still in my gut know that we're going to have some rough roads. And we're going to have to be able to get through those rough roads. And the roads will only be rougher if we don't heed to the guidelines and absolutely use caution. So before I go any further, again, a really tough part of this job is announcing that we've got two more deaths, a 70-year-old male from Kanawha County and an 81-year-old female from Jackson County. That's 60 people. 60 people is a catastrophe like nobody's business, except for the fact that in West Virginia, our numbers of 60 are just a fraction of what all the others are around us. But we want to still try to stop these numbers. I wish and I would hope and pray in every way that each and every one of us would remember all these people, as I've said over and over, remember their families and all their loved ones, and just know that what a wonderful contribution that they made to West Virginia and all the wonderful families and everything that they had, and that they won't be forgotten. And I am confident in every way that some way, somehow, at least I pray, they're all in a better place. I hate to just transition from that. It seems so disrespectful, but that's what we've got to do. We've got to go on. We've got an awful lot of calls, requesting that our health clubs and our gyms be allowed to open up. And so a lot of this was driven by the fact that we opened our wellness centers, and then there were those that probably pushed the envelope beyond what we intended, and basically they opened up, basically gym activities when it was really supposed to all be driven by medical supervision and wellness or rehabilitation stuff. And so with all that being said, I surely understand the unfairness, from the standpoint of, the health clubs and the gyms. And I do think that under the strictest of guidelines, that we can move forward now and open our gymnasiums. And so as of Monday, May the 18th, our gymnasiums will be open and our health clubs, and our, from the standpoint of our guidelines and everything, they'll be published tonight on our website. And so that gives us till Monday for the people, the owners and everything, of the gymnasiums and the health clubs to be able to get their staff ramped up or whatever they may need to go. We didn't want to put that off until the 21st or whenever it may be. So we'll let them go on Monday. And like I said, the guidelines will be up, and they'll be up later on today. Now, I've got several things to go through. I'm going to go through them pretty quickly. Our whitewater rafting and our zip lining, we have consulted with the rafting and zip lining companies. They have given us a tremendous amount of guidelines and everything. They're going to be opened up on Thursday, May the 21st. You know, the guidelines are on the screen right there, but you can see them on our website. Basically, what we're doing is limiting the number in a raft to 6 people, and limiting, you know, in a bus that is capable of probably hauling, you know, 50 or 55 people, limiting the bus ride to 18 people, to where the people can stay away from one another and keep the windows down in the bus and everything. And then there's all kinds of additional guidelines for the staff, and the cleansing of the rafts, and cleansing of all the equipment, and the not being able to use the equipment, you know, for different people and all that. So there's lots and lots of different guidelines, and you can see them on our website. But, you know, I'm happy to say that we're going to reopen. We're going to reopen on the 21st, and we're hopeful to have a great rafting season and the zip lining as well. But we ask, if you'll please just use really good common sense. Use your smarts and try every way in the world you possibly can try to be able to help us help you. As far as today, I am announcing our plan to increase COVID-19 testing opportunities for minorities as well as the vulnerable populations. The plan was developed with input from the Herbert Henderson Office of Minority Affairs, the West Virginia DHHR, and the West Virginia National Guard. And this optional testing will be free and available to all residents in these counties, including asymptomatic individuals. DHHR and the local jurisdictions, with support from the WVNG National Guard, will be conducting the first testing in Berkeley, Jefferson, Mercer, and Raleigh counties on May the 15th and 16th from 9 a.m. to 4 p.m. at the locations that are on the screen. And additional testing for the remaining counties will be announced at a later date. But these counties, we are targeting these counties to open up that testing, to be able to do a significant amount of testing and everything in order to be able to just make us one step better. And you can see the National Guard will be doing great work. They're going to be doing it in these counties on May the 15th and 16th from 9 a.m. to 4 p.m. So if you just have any anxiety or whatever it may be, and you think you ought to be tested and everything, please come in and do so. I guess from that, I should say just this, that our flags will be at half staff for Peace Officers Memorial Day. In honor of the Peace Officers Memorial Day, I've issued a proclamation in accordance with President Trump's proclamation ordering that the United States and West Virginia flags throughout our state be displayed at half staff tomorrow. I would just very simply, I would encourage all of us. Our police officers, again, give so much. And you know, for some crazy reason, we have gotten in a situation to where a lot of people are disrespectful to people that are the first people we call when we got a problem. You know, how in the world could we be disrespectful to those people? Think about what they're paid, you know, and think about how they've been paid for decades and decades. You know, just think about how important they are to us and everything. And so please, in remembrance of those that we've lost, and in respect of all those that are giving so much for us all the time, please take the time to be thankful and absolutely appreciative in every way. It's an incredibly, incredibly important time for those people, and it's an incredibly important time for all of us. So please do that. I want to say that Exxon has made an incredible donation. They have donated 2,400 gallons of medical grade hand sanitizer to assist West Virginia in its statewide COVID-19 response efforts. I want to also say that Smooth Ambler, did a lot of great work and did the same kind of thing and everything, but this product that's been delivered by Exxon is 485 gallon buckets that are being delivered to the National Guard facility at Poca. I just think that anybody stepping up to do this kind of work should be recognized. So we thank them in every way. We have federal money coming from our federal government, and today Senator Capito and Senator Manchin announced that over $57 million from the CARES Act for West Virginia are coming to Okay, guys, we're back, and we've had a delayed audio glitch this time, but I think I was talking to you about federal money that our senators have played a wonderful role in, and we salute Senator Capito and Senator Manchin for their help in bringing an additional $57 million. To West Virginia to increase our COVID testing across our state. And I want to surely thank them and surely thank President Trump for the additional monies that will allow us to do more and more testing in West Virginia. And the more we can do, the better. I tell all of you that West Virginia is now testing at a level of 3.86%, and the national level is 3.01%. And all of our surrounding states are significantly less than us, and so this is just going to make us better and better and better. I guess in ending up, what I have is, one other thing. We've had questions about, outdoor guided rock climbing. I would tell you to be very, very careful with outdoor guided rock climbing. And the other thing is our outdoor guided fishing, with 3 people maximum, inclusive of a guide, is starting up on tomorrow, on Friday the 15th. And the outdoor guided rock climbing will be allowed to go on the same date. So again, the guidance will be up on our website, and we just encourage you again to keep the strictest guidelines and try to keep people safe in every way. The last thing I have is just to remind you again about the census. I showed you the numbers yesterday. The numbers are terrible. Wood County, I think, was at 64.8%, and McDowell County was at 4-point-something%. Either one is not what we want it to be. We want it to be up in the 80s and 90s. So we have our best that we've got to make better, and our least that we want to make tons and tons better, and we just got to be counted. So please help me with that. It'll just help all of us for a long, long, long time in the future. I'd end with, our graphs that you see every day from the standpoint of we had a couple of days where we were at less than 0.5%, at 0.4%. We jumped back up to 2 or 2.1. We're at 2.1 today. That 2.1 is still great. The graph you can see is just teetering along, at a really low level, and we're really happy with that. Our cumulative number has now dropped from, it was 2.11, which we thought was unbelievable. Then it was 2.10, and now it's 2.08. It's just really, really good. And the other thing, our active cases to recovered, our recovered numbers now are right at 870, and our active cases are at 482. So we're continuing to widen that gap, and that's what we want to do. So the bottom line of the whole thing is just this. All your numbers tell you West Virginia can do more and more and more as far as giving us our freedoms and our liberties to be able to go back, and it looks like that our numbers are telling us that we're going to be okay. I would just tell you just this. Not Jim Justice, not our health experts, not you, not our federal government. No one knows for sure. All you've got to do is just continue to do what you've already done. Don't absolutely drop your guard. This situation is still with us. Now, we've got to go back because we know the consequences of not going back. So we got to go back in everything. And as we continue to try to open up and go back, we're going to monitor and we're going to watch nonstop. And if the numbers start to move a little bit against us, don't get upset with me if we have to shut stuff back down, because at the drop of a hat, we'll shut it back down in order to be able to protect our people. Now, as we go forward, we got to figure a way to live with this terrible disease. And as we go forward, all we're trying to do is get to that bridge that enables us to get to a drug that'll stop this thing. Right now, West Virginians, you're doing absolutely unbelievable. Just keep it up. Just please keep it up. Really, really watch and be careful. And really and truly, if you don't really have any burning desire to go do something, stay at home. Just stay at home just a little bit longer. And if you need to get out and wear a mask. Absolutely wash your hands, keep your distancing, and just keep up the good work you've already done, West Virginia, and it'll be okay. Thank you so much.
All right, thank you, Governor. Now let's go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slimp.
Thank you. Good afternoon, everyone. And the governor has mentioned the testing that we're starting this weekend as a result of the African American efforts to target more testing. I want to just add one thing that some proof of address or identification will be required. So if folks could remember that, and anyone under 18 will need to be accompanied by a parent or guardian. But we look forward to testing as many people as we can. As some of you may have noticed, we are pushing our testing very hard and trying to increase that significantly. In terms of that increase in testing, I'll give you a report on the assisted living facility testing, and I'll start doing that every day as I did with the nursing home testing. We have 94 facilities and approximately 4,800 individuals that we'll be testing. To date, we've completed 13 of those facilities in testing. So we're moving that as quickly as we can. And again, we want to thank National Guard and General Hoyer for their help with that. Also want to mention, had a question yesterday regarding mental health services in the state. This is actually not National Prevention Week. That is designated by SAMHSA, which is the Substance Abuse and Mental Health Services Administration, where we receive a lot of funding for mental health services. While we focus on the COVID-19 problem and the pandemic, I want to make sure everyone knows we are not forgetting our other services that we provide. We're having another meeting tomorrow. I have weekly meetings specifically with regard to the Office of Drug Control Policy and continue to make decisions there to try to help individuals. We continue to advocate and support vital recovery resources that are needed now more than ever before. Feelings of isolation and disconnection and anxiety are common in this situation, and they're concerns for those who have recently completed treatment services or just beginning that journey into treatment. Please remember there are resources to help. View the behavioral health pages on the coronavirus.wv.gov for assistance. Please let us know if you need assistance. Thank you. Be safe. Kathy.
Hello. Good afternoon. I'm excited to share with you today some of the county alert status implementation plan with you. We've been speaking about and had lots of good questions around. So as West Virginia begins to reopen, the early identification of areas that are seeing an increase in COVID-19 cases is really critical. So to prevent disease transmission, to reduce illness, and to save lives, the Governor Justice has directed DHHR to Bureau of Public Health to implement and to develop a county alert system, and we're pleased to do so. So this approach will really provide a consistent way to allow West Virginians to return to work while ensuring that we're monitoring change and, when necessary, taking aggressive steps to prevent resurgence. All the things that Governor Justice has mentioned as we're trying to make this balance moving forward. It's important to remember that what we do today impacts disease that we see in 2 to 3 weeks from now. And so that's why the importance of having this early alert system. We're currently, as you know, at the safer at home status as communities begin to expand their services and activities to undertake a new normal, as Governor Justice has outlined those activities. The system we're putting in place identifies when disease transmission is increasing in ways that warrant more aggressive, assertive public health action. It's based on thresholds. So these are new cases that are occurring over a week, which exclude the outbreak or facility outbreak cases. And then when that happens, when that threshold is met, we will undertake a rapid joint assessment, looking at additional data, understanding what's actually happening in the community, and getting a more detailed understanding of that. Following that rapid assessment, and based on the data, the governor would then issue a formal designation noting the county is in high alert status. What does high alert status mean? Essentially, it's an opportunity to trigger action by many. Depending on the local needs and issues uncovered, the actions to be taken would include such things as strongly reinforcing or potentially increasing community mitigation measures. It could include providing additional resources and supports, additional contact investigation and tracing support, expanded lab testing, education and enforcement supports to really reinforce or strengthen community mitigation measures. Once the county is designated as on high alert, then the county would remain on the high alert status as all work together to effectively make a difference and reduce that disease transmission. Removal from the alert list would be based on data reflecting decreased disease spread. Very quickly, a little bit about the science behind the effort. The thresholds are actually based on a 7-day rolling sum of new non-outbreak associated cases and calculated on population size. So it's something for each county with that. And again, the thresholds trigger a rapid assessment and information to make alert designations and guide action. We may adapt these thresholds as we learn through the experience as well. So in developing this process, we really appreciate the input and the support we've had from local health departments, from pandemic leadership, and others. We are implementing the system this week and initiating those rapid assessments triggered by the counties that would reach that threshold, and then high alert designations based on the data, if they're needed, would be issued shortly thereafter. Our real goal here is to assure early detection and increase spread, making certain that communities have and use the supports and tools and authorities they have or that the state can provide to take action and reduce disease. It really is meant to help all of us see where and when increasing disease rates are occurring and to provide an early call to action. At the end of the day, it's about reducing disease and protecting both our own communities and those around us. So we're excited to begin this process and look forward to working together with communities to do so. Thank you.
All right, thank you both. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. So I wanted to follow up briefly on what Dr. Slimp just articulated. And as we've talked, one of the secrets for us to be able to dance successfully as we come out of this suppression stage where we've acted as a single entity with the governor's leadership of trying to control the rate of spread of the COVID-19 virus, then now we're really focused on looking at West Virginia as a collective of 55 counties and making sure that we have the ability to detect and identify early changes in disease spread in these counties so that we can really more precisely move in and start to do the corrective measures that will allow us to stop these outbreaks from happening and getting to a surge level that we have talked about many times, but also so that we understand areas where we might have more opportunity to test. And as Dr. Slimp correctly and very nicely outlined, so that we can come in and really assist the local health departments and the county health officers who do such a great job. So as part of that, as we're following this value, the R naught value, which today is 0.83, yesterday was 0.89. So we're kind of moving back and forth in the sort of the 0.8 to the 0.9 range, which says, again, that each person infected in the state, at least as that prediction would tell us, is less likely to spread the disease in a more exponential way, in a more compounding way. And in fact, if anything, the disease is slowing down some. The lower that number is, the better we feel. But also, as we start to progress this, we really want to be able to do this also at a county level. And we will be giving you more information about that as that capacity becomes available to us. The only other thing I really want to re-emphasize that Governor Justice said, which I think is really important, as you read about countries that have come back together in Asia, some in Europe, certainly places in the US, and you start to ask the question, what can we do to try to come back out safely so that we are protecting ourselves and our families and our communities and our healthcare workers and our state? It is absolutely clear, and I know people said, well, it was unclear, but it is really clear that by wearing face coverings or masks, that is a really important part of the next phase of our ability to live successfully with the COVID-19 virus. And so I would recommend that certainly if you can't physically distance or if you're inside with other people, absolutely wear a face mask. We talked about 60% of people. Well, it's clear that 60% is probably the minimum, is the floor. But when we get to 80 or 90% of people, we're really much more successful. And if you're in places where you're sitting around people, even outside, and where there's loud conversation or singing or screaming or cheering, those types of situations increase the droplet spread. And if somebody is infected but doesn't know it or is not defined yet, that would really increase your chances of getting infected with COVID-19. So by all of us wearing masks and face guards and those kind of situations, we protect other people from anything that we may be infected with. And by doing that, we also become protected ourselves. So West Virginians, you've been doing so well, and we have been doing so well as a state. But this is the next step for us to really try to make sure that we remain leaders in this country and show others how we can stay West Virginia strong together. Thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Just to highlight a couple of things that the governor laid out, as well as others, and to give you some perspective. This weekend, in support of our public health partners, there will be 60 National Guard personnel working testing lanes over the weekend. So just to give you a perspective on the magnitude of effort that it takes to put these testing capabilities in place, just the National Guard personnel alone is 60 personnel over the weekend. And then I'd like to also highlight what both the governor and Clay Marsh have highlighted on when you're out as we open up, please pay attention to the guidelines, to the sanitization, to the spacing, to the face covers. And I want to put it in this perspective. In 2016, we had a devastating 1,000-year flood event. We lost 23 great West Virginians. So far in this event, we have lost 2.5 times the number of people that we lost in the 2016 flood event. And others we may lose. In addition to that, if you think about the economic impact that the 2016 flood had on West Virginia as a whole, and the economic impact that we've faced so far from this, part of what the governor and others point out, and the reason we ask you to do these things, is we don't want to have to go back, and we don't want to have to continue to grow the loss of life and the economic devastation as we open back up. So on behalf of all the guardsmen, all the first responders, the healthcare workers, all the folks that are out there working on the front lines, please follow the guidelines. Please help us open back up in a safe way so that we can continue to get back to normal as much as we possibly can. Thank you.
Thank you, General. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner today is Taylor Stuck with the Herald-Dispatch.
Hi, all. It's Taylor with the Herald-Dispatch. Going back to gyms, I was just wondering from a health perspective, what was the basis for not reopening gyms, and what now has changed that we can reopen? Or was it just, gyms expressing frustration that a few other gyms seem to be using what they called a loophole to reopen?
Well, Taylor, what happened early on was just this. Our wellness centers that were, I think that were designed to take care of rehab and things like that and medical supervision. Our wellness centers, we opened back up because we felt like we had the guidelines and we felt like we really needed that. We needed it really badly and everything. From the standpoint of our gyms, we know that what's happened when we opened our wellness centers, we basically had some people, push the envelope beyond what our intent was. And in doing so, they honestly were kind of halfway running a gym in some ways. Well, from that, we gleaned off information there, and we have absolutely watched closely and everything and tried to put together with the medical experts because, again, everybody should understand we want as much open as we can possibly have open, but we absolutely are trying with all in us to protect our people. And so it was not comfortable from the standpoint of our medical experts to open up our gyms until now, at this point in time now, through our medical experts and through all the different guidelines that we have in place, we feel now that we're ready to open our gymnasiums. And you will see as it comes out later on today, you will see more and more, you will see our guidelines, and they'll be strict. They'll be strict as to what to do and how to do it safely. And so we feel confident we can do it now, and that's why we're moving forward.
All right, thank you, Taylor. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. I wanted to talk about some of the bigger box stores that have been allowed to be open throughout the process. When you see, tons of people at stores and those bigger box stores waiting in line to maybe get in the store, how do you kind of compare and put in perspective how that is okay, but restaurants are only allowed to be at 50% capacity with only 25 or so people, and it's still not enough to properly do business? How do we put that in perspective from a health and economic standpoint and create a level playing field?
Well, Amanda, primarily one word, and that is, or two or three words, but the big box stores have huge square footage, and our restaurants, many of them are very, very small square footage. And so we're trying as to the best of everybody's ability. And, my dad would always say, don't confuse effort with accomplishment. So I know just trying isn't good enough. But what we're trying to do is put you into a situation to where we are absolutely trying to keep you as safe as we possibly can, and yet still allow us to be able to open back up. We want to be able to have the recirculation of air, in a facility that is adequate and everything. I mean, this we've learned from our coal mining industry and everything else under the sun, that, and our medical people are trying with all in them to absolutely do the things that makes us be able to get back to work and get back to normal as best we possibly can, and do it in a way that's as safe as we can possibly make it.
All right, thank you, Amanda. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams with Ogden Newspapers here. Obviously, we get, I imagine the other reporters here would back me up on this, we get a lot of emails and requests from people that have various questions on this and that, and people just needing some clarification on things. And this goes a little bit towards not necessarily the unemployment issue, but I had somebody email me and ask about their situation where they are a person that is still employed, but has worked from home this entire time. But obviously with things loosening up, safer at home order, even businesses that have been open and have been having employees work from home, some of them are either strongly encouraging their employees to come into the office versus continue to work home. They could continue to do so easily and still do the job that they're required to do. Are there any protections for someone that has concerns about being forced or strongly encouraged to return to the office when they are fully capable of doing all of their job at home, especially since the safer at home order still encourages employers to allow people from home when that's possible? Thank you.
Well, Stephen, I guess that's for me to try to answer. There's federal guidelines that absolutely, guide us, prohibit us, make it mandatory for us and everything of certain things that have to be done. You know, we can't force employers to make people stay at home. And we have got to understand that we are a free society and everything, that we guide people and everything, but at the point in time when we are forcing businesses to do certain things. Now, we did do that to some degree, but forcing businesses to have people to be able to stay at home and everything, when the business owner may think that that's not in the best interest of his business and everything, then we can't do that. And so it's just a matter of the one thing that I would say to everyone, and I just try to speak the truth. There is going to be, and I don't begrudge the questions at all, but there's always going to be exceptions. We're trying to legislate for the masses as best we possibly can. And we're trying in every way that we can in order to look after 99.9% of the people in every way. Now, in doing so, I get it that the media is a harbor for people to call in and ask questions. Can I do this? Can I do that? And everything, and then those questions come to us. But they're almost at times questions like, if you'll remember, and I know you're going to think that I'm silly in going down this path, but Clark Griswold worked as hard as he could to get his lights on at his house. And I think then his dad said, Clark, on the third line up there, there's two lights not twinkling. Well, that's right. And I understand for those two lights that aren't twinkling for an individual, it's really important. Really, really important. And I get that. And that's why all of our people are trying to answer all the questions all the time. But in this situation, we all have got to recognize just one thing, and that is just this. All of these people are doing great work. All the numbers that have been produced have been great, great stuff. And absolutely, as we go forward, we've got to remember this is a pandemic, and nobody has all the answers. All we're trying to do is protect you and look after you and get your life back to normal as close and as fast as we possibly can.
All right, thank you, Steve. Next, we'll go to Anthony Izaguirre with the AP.
Governor, how exactly do you decide when certain kinds of businesses get to reopen? It seems like you're basing these decisions on whether you get a lot of calls from a certain sector.
Anthony, that is absolutely 180 degrees wrong. I'm not going to do that. I've told you many, many, many times, I'm not going to do that. I am not going to succumb to political pressure when I think, and I've been told by my, medical experts and all the different soliciting of information that we come up with here, that it is the wrong thing to do, and there's just some political faction that's screaming to the highest heavens and everything, and therefore what we should do is rush out and do something. We're going to naturally listen, and I think we should listen to all the businesses, to all the people. We're doing all that. But at the end of the day, we're going to make our decision, as I've said many, many times. We're going to make it smart, with a ton of prayer, with absolutely the guidance of our medical community and medical experts. We're going to make it with the guidance of all those that are around us to make the right decision. And there's no chance that your governor is going to do something, to enhance something from the standpoint of a political pressure. There's no way. This is too important.
Thanks, Anthony. Next, we'll go to David Beard with the Dominion Post.
Hi, this is David Beard. Wanted to return to Commissioner Slump's explanation of that alert system and ask if she could re-explain, because I didn't quite catch it all, this 7-day rolling figure she mentioned toward the end and how that factors in.
Dr. Slimp, is you.
Governor, if you want to take the first step on that. Governor, would you like me to take the lead on that?
Yes, Dr. Slimp, go, please.
Sure. So what we're looking at is a 7-day rolling average of the number of non-facility-based outbreak cases in a community. And so what we're looking at there is trying to really get a handle on what's happening in terms of community spread. And then we will do that triggers a rapid assessment, because there's always more information than just on a number. Because those are new in case investigations, new information coming in. We got to look at that more closely. And then we're also looking at what's been happening over time as well to see if there's really a trend there. So that's just those numbers are just a trigger that looks at that assessment, looks at some additional things more over time, and talks to the county to understand what's really happening on the ground and get the latest in those case investigations so that we can make the right recommendation to the governor related to those things.
All right, thank you, David. Next, we'll go to Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Governor, you've talked a lot about listening to businesses and getting their input on making decisions about reopening and timeline. And you've made an alteration now based on your medical experts and the fact that some people were maybe pushing the gymnasium envelope. Yesterday, you mentioned tanning beds and included them in the order to open next Thursday. So the question is, with a number of tanning beds already open in the state, and a couple in Kanawha County, one just down the road in South Charleston, right here from the Capitol, when is the time for you or someone on your staff to address those situations in a manner of fairness to the businesses which are following your guidelines? And if there is going to be no intervention by the government on that, under the broad authority of the emergency powers that you're granted, well, what's to stop movie theaters or restaurants or outdoor dining to be full tilt, or people just to crowd into their favorite eatery? I mean, they can say thanks for the suggestion and then do whatever they want to do. So would there be a situation where you think would be important to rise up and say, hey, this is wrong, stop doing this, you can't go in business until next Thursday, or do you just let things unfold as they are?
Kenny, I just had some discussion over at the mansion just regarding exactly this, and we're going to look deeper today than we have in the last couple of days. You know, we're trying, like I said, we're trying to deal with a lot of different balls in the air and everything, and there are surely people that are, you know, and I don't want to say cheating, but they're pushing the envelope, and so we're dealing with it, and as you've seen in the past, I am surely not going to just turn away and act like I don't see. You know, if you know our people come back and they report and everything, we'll move swiftly to shut them back down and address the situations.
All right, thanks, Kenny. Next, we'll go to Paul Mullen with WCBC Radio.
Good afternoon, Governor. Thanks for the time. Saturday is Armed Forces Day, and during your term, you've had to lean on the National Guard fairly heavily, especially in the latest crisis. Could you give me some words of support for the Guard and the members out there, and maybe have General Hoyer also talk to his troops via this press conference?
Well, it's always really easy for me. You know, I've seen these guys and ladies just pull off miracle after miracle. I've seen them wade in mud and heat and sweat and the bugs biting and everything else. I have seen them absolutely put their lives on the line, and I've seen them deploy and come back home. You know, it's as simple as this. We owe every single thing we have, everything we have in our existence, almost everything, to the fact of what these great people are doing for us and have done for us in all of the years of our existence forever. And so, you know, from the standpoint of, you know, of all of our veterans, all of our active military, all of, you know, the fact that West Virginia, the highest per capita of anybody in the nation, I mean, absolutely, we are a state. We are a state that has that has held up this nation over and over and over. And so I would just tell everyone, it's just as simple as this. I mean, you know, we need to step up and recognize and appreciate absolutely just exactly what all these people have done, you know, for us in every way. You know, if you look at our vets, you know, first of all, you know, and I say this very proudly, I don't say this braggadociously, but, you know, one of the things that I was able to do right off the get-go, you know, was not defer, but prevent or do away with taxation, you know, on retirement within our state to the, you know, on our veterans' retirement. You know, it's nothing. It was an absolute nothing, but it was the only ask at that time and everything. And I said to the veterans that were there, do you have any idea what this would cost? We were in session, and they said, well, we think we've been told like $2.7 to $3.2 million. Now just think about it. Think about how much they've given and how little they ask. And they were asking for something that was a $3 million ask, you know, in a budget of $4.5 billion. We owe them everything. And that's the way we should look at it always.
I'll add a couple things. It's hard to follow that. I think the governor hit it pretty daggone well with his comments, but just a couple of highlights of, and I appreciate your recognition of this and the comments. Right now, 700 guardsmen on duty supporting this event, 1,000 guardsmen deployed, guardsmen coming home today and tomorrow from deployment, guardsmen going back out on deployment. And in the staff meeting this morning, we were not only preparing for future deployments overseas, but being the process of preparing for the potential of a flood this summer while we're dealing with this. And I'd also like to make sure that we also understand our active duty brothers and sisters who are involved around the globe today and throughout the year, as well as the governor highlighted our many veteran brothers and sisters from the state of West Virginia. Thank you.
Governor, I'll turn it back to you.
Well, you know, I really don't have a whole lot to end with. You know, that the last question, I loved the last question, and I really appreciate that because it gave us the opportunity. And you know, we have an incredible general and General Hoyer here, and the work that he's done is just unbelievable. And you know, he's been with us for a good little while, and I hope to goodness that he'll be with us for a long, long time. But you know, I would end by just saying this. You know, a lot of times I'm asked the question, are you concerned? Are you worried? Are you concerned about this pandemic? Are you concerned? And I'd say, you're dadgum right, I'm concerned. And I would say to you that just this, we're going to be concerned and we're going to be worried with me at the top of the list until we get a drug that will stop this or a vaccine that will absolutely prevent it. Now, you as West Virginians have got to know this, and I have said it over and over and over. Do you realize that you in West Virginia are leading the nation? You're the example. You're all over the news in this nation for how great you've done. This thing's still here. We need to be worried. We need to be concerned. We need to be prayerful. And we need to just watch out. For crying out loud, West Virginia, wear your mask. Wear your mask, West Virginia. And absolutely follow all the guidelines that we've told you and told you and told you. And please, please watch out for the elderly. We're starting to open back up more and more. We've got to be more and more and more on our game. You're doing good stuff, but we got to be more on our game. Know that you've got a strike force right behind you that's going to run to the fire if we have an outbreak, and we will have outbreaks. We know that. And we'll run to the fire to stop it. But you got to help us, West Virginia. You've already done unbelievable. You're leading the nation, West Virginia. Just keep it up. Thank you so much.